Well, and that leads me to mind is one of the hard parts with aging and being diagnosed with any kind of chronic pain, neuropathy or otherwise, the big piece of the puzzle too is acceptance. Because who wants to accept that you have chronic pain? Anybody here? Right? Anybody? I got to tell you, when I first got diagnosed officially with rheumatoid arthritis, I'm not a big drinker. I went home, got a bottle of rye, I drank 3 shots back to back, and my son's looking at me, he's going, "Oh my God, Mom, this must be really bad." And I'm going, "Yeah, it is." And it took me a long time to wrap my head around the fact, you know, that I had chronic pain, and I was thinking, well, you know, I want my life as I age, kids are blowing the nest, you know, I want to carry on. So really, you guys, a huge part of this too. It's not exercise or meds or anything, but the bottom here is accepting that, you know, this is what this blow I've been dealt, and this is where the depression and anxiety comes in, and nobody wants to accept it. But I'm saying it's really hard to make friends with the fact that and accept that we have pain. Really difficult, but I got to tell you, if you can't wrap your head around and accept that, then you're going to be the one with the severe depression, the anxiety, and the pain that's not going to come down at all, because that is a huge component in healing.
Do you have any advice for the people who have idiopathic neuropathy, so they don't even know what's causing it? I know what causes mine, and I'm frustrated enough, so I can't even imagine what it must be like for those folks.
Well, the thing is the way I view that is that pain is pain. You know, sometimes we want to know why. Like being human beings, we always want to know why. And I tell people, throw out why, it doesn't matter. It doesn't matter why anymore. Do you know what I'm saying? And that's really hard because we want to understand cause and effect. But again, that's how our mind works. But sometimes we have to sort of go more on the Eastern side of things, to the Eastern philosophies, and really get down to the fact that, you know, we have to accept this. And again, because we, you know, our minds are always inquiring, and we want to know why, because we think if we know why, we can fix it. And I'm going to say, no, you can't. Chronic pain and the changes, because they're permanent in the nervous system, do you know what I mean? It's not going to go back. And so this is the hardest piece to accept. So why, you know, is irrelevant. And people get mad at me. and I always say, don't throw something at me, but it's go ahead. I've got you. One guy at the back and then you. Yes.
I just have a technical question. Is arthritis and neuropathy, they are related? And if you have one, if you don't have the other?
I just missed the first word.
Arthritis.
Arthritis and neuropathy, are they two separate or they are linked together? If you have arthritis, you would have neuropathy?
You can have both at the same time. So, and quite often both.
So how are they related?
Well, arthritis generally, okay, so if we take osteoarthritis, does everybody understand what the difference between osteoarthritis and rheumatoid? Okay, so the easiest thing, I wish I could show a big picture in my hands, but osteoarthritis is when we get bony developments. Do you know when we look at our hands and we sort of get lumps and bumps on them? That's osteo. So in our body's attempt to heal damage, what it does is our body, in its wisdom or lack of wisdom, sends what's called osteophytes. So basically, it builds protection around a joint that's injured, and it sort of it causes us to become immobile. So if we've been broken bones or had, you know, trauma to our back or car accident, for example, a lot of people get osteoarthritis in their back or hands. So that is one type of arthritis. So neuropathy is more nerve damage to how the nerves function. Does that make more sense?
Yeah.
Kind of? Yeah?
I don't know how are they linked at all?
Well, they're not, like they're separate.
They're not necessarily.
No, they're separate diseases.
But you could have both at
Yes.
the same time,
Yeah,
but they're not related to each other.
Yeah.
And osteoarthritis, again, people in their 20s, when they did veterans from the Vietnam War, even kids that died in their 20s, they were finding osteoarthritis in the back developing already. So it comes with aging, but go ahead.
Yes, 2 questions. Number 1, when you're socializing with people, do you talk about your pain, or do you zip it up?
Okay, I love that. Yes, okay. So people, okay, depends who you're with, okay? However, you know, people, if let's say you're just going out to a group where you don't really know, people will ask politely how you are. And a lot of my chronic pain patients, whoa, they explode on people. And people are really uncomfortable with pain. Doctors are uncomfortable with chronic pain. Some doctors don't even want to treat chronic pain. So in a social setting, unless you know someone really good, if they ask, always err on the side of caution. Less is best. Do you know, like if you got a best friend that you need to phone and spew and vent, good. But social, understand, trying to teach people about your pain. A lot of time people sort of nod, but they get, I don't know if anybody knows, do you guys notice people get uncomfortable if you talk about your pain?
Mm-hmm.
Always.
The eyes glass over.
Yeah, the eyes glass over. You know what? Yeah, and they kind of go, oh yeah, well that's nice, yeah, I gotta go, right? I tried that. I had cancer when I was 25 and I had 2 years of chemotherapy. And I used to go to things and I'd say, I have cancer, you know, being young and silly. And people would just like, they couldn't get away from me fast enough. So again, with pain, same thing as cancer, any kind of medical diagnosis, unless it's somebody you're really comfortable with, people ask out of social niceness, but they really don't get it.
I find a few people that I don't ask, how are you?
Yeah. Yeah. Go ahead, you have it.
So the second question, through my fibromyalgia doctor, she's considered one of the tops in North America. I took a course called neuroplastics.com.
Yep.
And basically they say that the pain is all in the brain, but it's physiologically in the brain receiving signals from the nerves.
Right.
And that you can't overcome pain. I'd say it doesn't work for me. I'm sort of caught in between this neck pain that keeps going out and in, and I don't know whether that's acute or chronic because all for 5 years going out and in, I put it back in myself because you can't go to a chiropractor 10 times a day.
Oh God, yeah. If they wish, right?
So, anyways, I thought I'd bring that up because that doctor at neuroplastics.com, ending in an X, has a whole course on that.
Okay, now I'm going to use an example on that. So what they're talking about is that if we do enough of, you know, self-thinking and self-education and affirmative self-affirmations, including meditation, such, what the theory is that we can change, you know, if you think of nerves as a dandelion, so if you cut the root of a dandelion, it sprouts a new one. So the nerve, so if you've got nerve pain in your hand, you know, you get sort of new nerve endings. They come up to the brain, they come back. With neuroplasticity, what their thoughts are that if you can focus and redirect your pain, that if there is a mismatch in these signals going up from the nerve injury, that there'll be more rerouting and your brain will say, no, there's no pain. So basically, it's redirection of how we're thinking, but it actually makes changes in the direction of our nerve endings. Does that make sense, or am I confusing everybody? Kind of, sort of, go ahead.
I'm not sure it's the same thing, but I know everybody's talking about mindfulness these days.
Oh.
And, but apparently there has been a lot of research with mindfulness and chronic pain, and that it does
Okay.
show it.
I'm going to come to that in a sec, but I want to give you an example of what you're talking about, neuroplasticity, then I'll go to mindfulness. Neuroplasticity changes, for example, if a person has an amputation from the knee down, one of the things is they did some really cool work in Australia with mirrors. And this person was feeling a lot of pain in a foot that wasn't there anymore. And what they did, so neuroplasticity, is they tricked the brain by using mirrors into thinking that there actually was a leg on the right leg that was amputated. So there was actually changes in the plasticity. The nerves finally realized there was no pain. Because sometimes you can heal, and the brain, because there's broken wiring, whether it's from up or down, either way, there's some kind of broken wire somewhere along our electrical system. You know, if we can make the brain realize and redirect that it is fixed, you know, that's neuroplasticity, and they demonstrated that by using mirror therapy. So that was one way. So I know, and that's why I get frustrated when people go to these courses, because sometimes if it doesn't work, they feel it's something they're doing wrong. But again, the brain is really complex, so it does not always work. Getting to mindfulness. Now meditation, I hate the word mindfulness, you guys. It's overused in our whole world. It should be thrown out. So basically, to me, mindfulness is really paying attention to how we feel and using strategies, you know, again, of deep breathing, just focusing, being present now. Do you know what I mean? A lot of times with anxiety or depression, we live in the past, present, and future. Why do I have this disease? Why me? Why can't I get the pain down? Do you know what I mean? And a lot of people have tutored. Go to meditation, it will help. For some people, actually meditating and, you know, it helps center them and bring them into the present, good. But overused, because I got to tell you, when pain is severe and these spark plugs are firing, there isn't a lot that's going to bring it down unless you meditate a lot of times. Trying to relax, going for a walk, diverting, and changing. So if you're in a lot of pain, mindfulness to me, if you're in a lot of pain, go for a walk. Pet the dog. Go see your kids. Do something different. To me, if you want to call that mindfulness, that's mindfulness to me. But I'm very frustrated as a psychologist with all of these people saying, well, just breathe. Well, when our anxiety is through the roof or we're depressed, that isn't going to help us. By then, it's too late. So again, trying to really understand that, you know, if we do good self-care, so that could be doing stretching, yoga, deep breathing, or if we're getting really nervous. And one thing with anxiety, to know if our anxiety, and again with chronic pain, anxiety, and depression are married. There's very few people that I know with chronic pain that don't ever get depressed or anxious. That's why I'm saying exercise, blow off some steam, do something. But again, change of direction. So socialize, go visit the daughter-in-law, whatever, just change, divert.
And that also means changing whoever is helping you, because, I mean, when somebody tells you you can never do this ever again, like I was told, I'm never going to walk, I'm never going to talk, and I can't shut up now, but that's when the brain that was damaged, that you know, and I'll know body signals when to shut up. But if I feel like talking to you more, I don't use those things that I've been taught because, you know, so you learn a lot. But if somebody keeps telling you, we can't change that, there's nothing else we can do for you, your mind then takes over.
Well, and that's where the depression comes in. So this is what I'm saying. And again, when you've diagnosed with anything, no matter RSD, everything, it's like, you know, professionals and family, you can't do this because this is, and my advice to people, be a renegade. Do what you want to do. And if you have pain for 3 or 4 days after, and I'm not saying go out and destroy yourself, that's not what I'm saying here. But if you need to go and do something that you really need to do, even if it's at a lesser pace, do what is in your heart to do, because it's very frustrating with chronic pain. There's a lot of no's. No, you can't do this, no, you're that. And you know, our world is through, at this conference I was just at, we had Dr. Gabor Mate, I don't know if anybody's heard of him, and he's a physician from Vancouver, and he gave example after example of how powerful our mind is in that, you know, of taking back control. You know, of people who have been diagnosed and they've been told no, of how they've actually overcome a lot of adversity. So
even the families or people around you that can't accept it or have a hard time with your pain, you know, then that shows, and then you can't ask them for that kind of support there.
Right.
I know at the beginning, like I didn't know for years, but my mum wanted to pull the plug on me, and thank goodness there were other people around me. I mean, if I had a choice and I was speaking there, I would have agreed with it at the time. You know, if I'd known how long it was going to take me to do things. So
it's a tough one, and
For everything, look, I mean, it doesn't matter, we're all individuals, eh? So whatever we're all dealing with, it's all individual.
It is very individual.
There's a denial and a framework in the medical society. For example, I went into emergency here this summer, and they said, what's your pain level from 1 to 10 in your stomach and nausea? And I said 11, and they said, we don't have 11 from 1 to 10. I said, well, I have 11, and I said, it's intolerable, but my pain is 11. And I said, it's just over the board. But this is what I have to just say 10, because that's as far as they're going to go. But it doesn't matter that I have 11.
Well, and again, you guys, rule of thumb here. Rule of thumb, chronic pain patients are the toughest people I know. You guys have a pain tolerance that is higher than most people walking around. So again, you guys, you gotta take the ball into your own court. And you gotta make friends, and I know this sounds, you guys, don't throw anything at me, you gotta make friends with this pain and accept it. And say, okay, today I'm having a really bad day, well, okay, today's my take it easy day. You know, and be okay with that. Today I feel good, I'm gonna do this. But that's why, I'm part of this group called Exercise is Medicine. And trust me, it is. So this is the missing puzzle with a lot of chronic pain people, because we're afraid. We're afraid to move because, oh my God, if we move, And so again.
And I think that's where being in a group, that it is a bit of socializing.
Yeah.
But you can't do it on your own, or it's too much of an effort. But doing it in a group, you're getting somebody instructing you with a little bit.
Yes.
And again, just doing whatever you can.
Yes.
But it becomes a social rather than, so you think it's a motivator rather than...
And it is. And that's why I advocate to say, you guys, get out, mix, even if you're not Miss Social Butterfly. Being with other people. Now, pain is lonely. Chronic pain patients, it's sort of a lonely road, right? But people are never going to get the earlier question, do we tell everybody about our pain? For the most part, no, because people are never going to get it. But that doesn't mean you can't get out and about, be with people, do things. So this is that 70% piece I'm saying to you, to avoid the depression, to avoid the anxiety. Because as soon as we get anxious, our blood pressure goes up, our breathing goes shallow. That's why they talk about this breathing all the time. And we tighten up. And as soon as we get tense, guess what happens to our pain? It becomes 11 out of 100. Or 11 out of, 100 out of 10. Do you know what I'm saying? Go ahead.
Do you think it's a good idea to make friendship who has got a pain, or a friend without pain?
Say that again, I'm sorry.
Is it a good idea to have a friend like me who has a pain, or should have a friend without pain?
Absolutely.
Which one should I prefer?
I think you prefer both.
Oh.
You know what, you guys? Because I'm serious. Because sometimes...
Group here.
Well, this is mine, I know.
Yeah.
And you know what? Because if you're in your pain group, you guys can actually talk about pain. Do you know what I mean? Oh my God, I tried gabapentin, it didn't work for me, and then he gave me Lyrica. Well, that didn't work neither. And you can vent to each other because you understand. But the thing is, if you have your non-pain person, they're going to go, huh? Oh, well, just take some more drugs. And then you're going to, get depressed.
I hate it. I don't know if anybody else experiences this, but I'll say I want to do something. Like coming up here today, I ended up coming up by bus and sea train and stuff. And I have friends who, no, don't do that. Oh, you'll be so tired tomorrow. Well, that's my choice.
Yes.
I wanted to get out. I wanted to stop at one place and look at something and go into a place that I haven't been to for about 5 years. And I did that. But I know if I tell certain friends, who are dear friends, they goes, why did you do all that in one day? And I said, well, that's my choice. I plan my activities, I'll have a good day, and then I'll have 2 or 3 quiet. And the first one, I know, I tell a certain person, she'll say, oh, you'll be down for 3 days, you won't be able to do stuff. And I said, but I'll go for my walks. I'll get up and I'll go for my walks. I choose to do it because I want to do it. And it's so frustrating. And then if I say, oh, you're just frustrated, oh, you're just getting depressed. I hate that word. I just want to wrap it around somebody's neck and hold it tight.
But you're the opposite of depression. This is the recipe, you guys, for not being depressed. is to do, again, marching to your own drum and doing what you want to do, not what everybody tells you can't do. And this is the big one, not only aging, young or old, chronic pain. This is why I'm saying to you, I don't want to see, people that are severely depressed. My job as a psychologist is to send the message to take your control of your life back. And there's all these do-gooders out there, like your friends, don't do that. So if you choose and you're in pain, your choice.
Do you know what I tell them? I'm the only one that can set limits for myself.
And you got to keep that. Go ahead.
Being stressed spelled backwards spells dessert. So just think of it that way.
Well, and again with that
Something
one,
good in your mind.
stress kills, guys. Stress kills. Like that old type A personality thing. So this is where...
Spelled backwards is dessert.
Oh, now
Oh,
you tell
I
me.
like that. But where we go back to, again, acceptance. Again, to get through this without becoming severely depressed, severely anxious, or giving up, is again accepting this is my lot in life. I don't know why. We'll never know why. Why me? Do you know what I'm saying? Why me? Well, guess what, folks? There is no why me. It is, but it is. So I like to deal in realities. This is my thing today. I'll deal.
I find if people know you've got issues, that you get more respect, that you're out and they know you need a little help or something.
Yes.
I find I get more respect with this.
Because it's visible. It's visible. See, the pain is visible. I always say to my people, geez, you know what we need to manufacture these big Band-Aids with a big red cross on them so people know you have pain, right? Yeah. Because again,
Handicap parking.
yeah, and so you got it. Again, humor. Humor is so important to be able to look at yourself and say, wow, okay, I've got this chronic pain, man, it's killing me, but okay, but I'm going to do what I can. Do you see what I'm saying? And looking at that, but you guys, the bottom of the pyramid is always going to be acceptance, not getting angry. Is our medical system great? I'd rather have a vet for a doctor. I'm sorry, I like my vet, love my vet, and I'd rather have a vet, but I don't get to do that, right? So over the years, I've been able to educate my doctor, but I'm lucky because I have all this education. Do you know what I'm saying? But accepting the medical system has flaws. There's not a lot of financial. Now, our system is slowly changing. I've seen a lot of positive coming. There is, but everybody has to be a soldier. But accept and educate. Does that make sense? But do what you guys want to do, not what everybody tells you to do.
I'll give you 2 more points.
Go for it.
The best medicine is your handicap parking is when you're going somewhere and there's a parking spot. It's the best medicine. It gives you a good feeling. And another thing is when you're going out to a group thing, that you don't have somebody knocking on your door, so-and-so, do you want to come out to play? That you go somewhere and you've got a group built in.
Yes.
That you don't have to, like she says, somebody says, oh, you can't go here or whatever. You go and you're surrounded with people.
Yeah, with support. So,
And there's support there.
and the thing is when people tell me I can't do something, man, that just gets me riled up. I don't know about you guys. It's like, what do you mean I can't do that? I'm going to do it. So figuring out a way to adapt to things, because part of the difficulty with a diagnosis of chronic pain, whatever the pain is that your world, what you used to do, you think you can't do it anymore, but I'm telling you, there's creative ways to adapt to almost everything, if we can be creative.
I'm glad you said almost, because there are days when you just have to say, that's
Done.
it.
Yeah.
I'm out for today. I'm going to just rest up, not go anywhere,
Yes.
vegetate or whatever,
And
watch TV.
chronic pain people, we do need more rest. We do need more care. And this is what I'm talking about, acceptance. Is it who we want to be? No. Is it what we plan to be? No. But it's our lot in life. So we either fight it, you know, and get depressed, get anxious, and not, you know, heal. I mean, chronic pain means that, like I said, these nerve sensors, you know, with neuropathy, they've permanently changed. So accepting and saying, how can I adapt? As much as, I don't want to say American military, but the Marines adapt, overcome, and improvise, believe it or not, they had a good one.
You say when you become a senior, you start reverting to be a child. So I become a Mrs. N.O. and no. And the doctor said that I had a curfew for this whole month. I couldn't go anywhere because they were going to monitor, you know, my sugars and everything. And so I couldn't go to a diabetic educator. But because she doesn't live there. And I said, I'm in a nursing place. And I said, well, that's not my fault that you don't have one here. I'm going to go because I'm entitled to get information.
Yes.
And so then, you know, whatever they're saying, I said, I'm going out. I mean, it's your fault. I'm not in communist China. I have the freedom to go.
Yes.
And so, you know, tell me what's your policy here? I mean, does it mean I'm like in jail? I mean, I'm not supposed to be in jail, but it seems like it. You know, you have to really stand up.
And again, that speaks to us our self-efficacy. So self-esteem is one thing. Self-efficacy is our belief of the control we have over our lives. And this is what I'm saying to you guys, is it's whether exercise or being told you can't. I mean, it's you guys marching to your own drum and adapting to what you can do, what you can't do, but accepting that. You see what I mean? And you're fighting good.
I read one time that 70% of our society are like yaks. They follow.
Yeah.
And there's only that small amount that are leaders. And I think we have to become leaders in our own life.
Absolutely we do. And that tends to listening. You know, somebody said to me, we've lost our instinct. And I think with chronic pain and being involved in the medical realm of doctors and everybody telling us what we shouldn't do, is we lose that. So I'm saying fight back, take your instinct back, because if you want to have less depression, less anxiety, less mental health issues, that's how you do it. Do you see what I'm saying? That's how you do it.
So we traveled quite far from this point. Some people there in the back row said something about the relationship between neuropathy and arthritis. While arthritis or neuropathy may be comorbidities, and I was wondering if it's possible that bony impingements and stuff like that can cause neuropathy, and that would be the one.
Well, absolutely.
Stenosis.
Yes. Stenosis actually is a good example, because the thing is, or again, like, you know, when you have bony outcropping, let's say in your spine, that's a buildup of the osteophytes, of the bone tissue. That's why I said our system doesn't know when to stop, and it can press on a nerve. And you have to understand, for a spinal stenosis or any kind of impingement, for nerve impingement, when you guys are getting that kind of pain, it takes the thickness of a dime or less of pressure on a nerve to cause severe pain, really disabling pain. So an impingement can really cause that. But again, so arthritic nodule developing or spinal stenosis, any of that. So that's how little pressure it takes on a nerve. If you think how thin a dime is, it takes just that much pressure to put pain on a nerve till we're on our knees with pain. So absolutely, so our nerves are super sensitive, so it doesn't take much. So to get that kind of pain. So again, we have to be really aware, and I'm just going to go through here a little bit. So again, dealing with it and trying to figure this out. Now, the one thing, fibromyalgia and flares. Again, fibromyalgia is notorious. The other thing with fatigue, has anybody had a concussion here? Anybody ever had concussions? Did you guys fully recover? Okay, so with some post-concussion, people have what's called chronic fatigue. And some concussions can cause permanent, long-lasting fatigue, as in a lot of times they're diagnosed with fibromyalgia. So again, with chronic pain and exercise, it's really important to work out regularly, but bear in mind of how you are physically. So again, this alludes to, you know, trying to pace. So not just getting angry and saying, I'm going to go do it, but pacing. And the hard part is the acceptance with a chronic condition. We forget how to pace. A lot of times we get into this all or none behavior and darn it anyway, I can't do that, and you go out and you hurt yourself. So again, pacing. So that's what this is related to. So I'm hoping that makes sense. Okay. So points to consider. So again, starting slow, go low, start slow. But just remember, 30% medication, 70% self-care. One component is self-care, exercise. Another one is our attitude. A huge one is how we view what's wrong in our life. And accepting, this is my lot, I'm going to make the best of it. So and that's where good mental health comes in. Again, relationships, community, being here, talking to each other about your pain. And if you go to a wine and cheese, that's totally social. Don't bring your pain because they won't know what to do with it. So again, fully, trying to look at all aspects of your life. Chronic pain patients, we get to the point where we just think about our pain all the time. But please work on trying to expand the horizons. Does that make sense? Do people have more questions? How are we doing so far? I don't know how I'm doing for time. I think I'm pretty much done.
4 or 5 minutes.
So again, my message is question your medical people. Question. Question. Don't take everything point blank. Yes?
So it's kind of unfortunate, you get a different opinion from a physiatrist, or an orthopedic surgeon, to a rheumatoid arthritic specialist, or rheumatologist. Yeah. So you may have to go to 2 or 3, and then the system might say, well, because of your records, because of your past behavior, you can't, like I've had in my own situation, you can't change doctors because you change doctors because you don't like what they say. So they're making
and it's hard.
assumption.
Absolutely.
Yeah.
And again, you got to understand, even in the field of rheumatology, rheumatologists are not trained in pain management.
They're not which?
They're not trained in pain management.
And what are the training?
Giving medications, to deal with the pain, but to be honest with you, they still fall into that scope of practice where they don't have the pain management background. Orthopedic surgeons, this is the issue when we have bone issues. Orthopedic surgeons, I just smile because I love orthopedic surgeons, but they're bone guys. Is the bone fixed? Yeah, there shouldn't be any pain. I see so many people. I have a fellow that I'm treating right now that fell and broke both feet. Severe neuropathic foot pain. This guy, he's young. And he goes to his orthopedic surgeon. Yeah, you're good, but I'm still in pain. But you're good. You're healed. You got to understand, a bone doctor is like a mechanic. He just looks at the bone. Is the bone fixed? Understanding nerve pain is a whole new science. And the medical profession is not caught up on that. So yes, pain is on our head. We process it there. But that's why I'm saying to be aware, listen to yourself, and I know you do have to sometimes doctor shop, but understand where it's coming from. An orthopedic surgeon looks at the bone, is it healed? Even some neurologists don't get it. So again, trying to keep sane in this process is tough. That's why I suggest being together as a group. I'm happy to see, reaching out to people. Don't isolate yourself. But the medical process, I won't lie, is frustrating.